In this video, I'm going to review the anatomy of a rat. Okay, so we'll start out by taking a look at the head. So, as you'll see in the PowerPoints, this structure here, which you probably call an ear, is actually called a pinna. The ear is deep inside the head. This opening here is called the external auditory meatus, and it leads down to a tympanum. So just like the frog, rats and other mammals have a tympanum or eardrum, but it is set at the bottom of an external auditory meatus. The pinna is essentially a sound collecting device. Compared to other tetrapods, mammals have extremely good hearing, mainly because they evolved to live in, or to be nocturnal, I guess. Okay, so there you can sort of make out the eye. Now, just like in the frog, the eye has a nictitating membrane. It's pretty difficult to see without looking at it with a stereo microscope. But in us, it's that little triangle at the corner of your eye next to the next to your nose. So that's what the nictitating membrane is. These little hairs here are called the vibrissae. And here you can see the external nares. All right, external nares. This line is called a philtrum. And there you can see the incisor teeth. That's about all we're going to really say about the head. So the rest of the time we're going to focus mainly on the abdominal cavity. Now I'm going to leave the digestive tract for last, but we'll take a look at a few of the other parts of the internal anatomy. So this large organ here is the liver, again, the largest organ in a mammal. Now most of this, okay, we'll go ahead and mention that's the stomach there. Here you can see the spleen. All right. So notice the spleen sort of hangs off by a little ligament called the gastrosplenic or gastrolinic ligament. It's part of the mesenteries. And it's on the greater curvature of the stomach. All right, underneath that, you can see this big bean-shaped organ here. That's a kidney. And once again, it's actually outside the coelom, although it may not look like it. It's not quite as obvious as it is in sharks, but you do have parietal peritoneum covering this organ. All right, so let's see. This specimen is actually a female. And you may notice there's a tube here. That's an oviduct. The two oviducts come down to a common area here, which we could call the uterus. Something like a rat, the embryos actually start developing in the oviduct. Sometimes we will dissect one that's pregnant, and she'll have multiple embryos along the oviduct. Okay, let's see what else we want to talk about. So in the rat, or in mammals, the coelom has three divisions. So this area here would be the abdominal cavity. And then in front of the liver, you have a diaphragm. So that is this muscle here. Now you probably know the diaphragm contracts rhythmically, pulling air into the lungs. So on the other side of the diaphragm, we have lungs. There are some, and then there's some more on this side, on either side of the heart. They are in what's called the pleural cavity. So the pleural cavity is in front of the diaphragm. And then here in the center, you can see the heart. That's the those are the two ventricles. So mammals have four chambers in their heart. So they have two ventricles and two atria. And the atria on the right and the ventricle on the right, those contain deoxygenated blood. On the other side, they contain oxygenated blood. And those things never mix, or the deoxygenated and oxygenated blood never mix. Now, in front of the heart, it gets kind of difficult to see things without using a stereoscope. I'm just going to point out that tube you see running there with the rings in it. those rings are cartilage, and that's the trachea. So that brings air from the mouth down into the lungs. Okay, so now let's take a look at the digestive tract. So the digestive tract, you already saw that in something like a frog, the intestine has a couple of divisions, or 3 divisions, I guess. Here, there's even more. So let's take a look at this, and we'll move through it one step at a time. So right here, between the liver and the spleen, you can see the stomach. Now, we should be able to find the pylorus here. Yes, so notice there's a little constriction right there. That's where the pylorus is located. Now, right there, sitting in the same location as it is in a shark and a frog, we have the pancreas. Remember, the pancreas makes enzymes that it dumps into the beginning of the small intestine. Just like in the frog, the small intestine of mammals is divided into a couple of parts, actually 3 parts, whereas in a frog it's just 2. So in mammals, the first part is the duodenum, just like in the frog. Now, the way the duodenum is defined is you follow it down, all right? See how it makes a turn at this point? That's still duodenum. You follow it up again, and then we start to lose it. But maybe you can sort of see here, the duodenum is coming up, and then it turns again. That's the end of the duodenum where it makes that turn. The next section is referred to as the jejunum. Now, at some point, the jejunum becomes an ileum, but we can't really tell where that occurs without making cross sections through the intestine and looking at the height of the intestinal mucosa. So that has to be determined with microscopy rather than with gross anatomy. So at some point, you sort of follow this along. So at some point, it does become ileum. All right, where exactly, we won't worry. But eventually, you come down here. See, that's really long compared to other organisms we've seen. You come down here, and then there's this big sac. So you see that people see this and they think, oh, that must be the stomach. No, that is a division of the large intestine. That's the cecum. So coming into the cecum, coming into the large intestine, you have a branch, or you have the ileum, and then going off in the other direction, there's also part of the large intestine. Now, this gets difficult to see unless you cut all these mesenteries, which I'm not doing in this illustration, but I have a picture in the Practice Practical that shows you a rat with all the mesenteries removed. But coming in here somewhere, we have the ileum, and there's an ileocecal valve, kind of like the pylorus, connecting the ileum to the large intestine. And then you have, going in one direction, you have the cecum. Going in the other direction, you have what's called the ascending colon. So that's what that tube is right there. All right, again, it'll be easier to see in the specimen in the Practice Practical. So the ascending colon will go behind all this stuff. Again, like I say, kind of difficult to see, but eventually, you see this part here? Let's see if we can show you this. So what's going on here is we have ascending colon on the left, then there's a transverse section. Transverse means perpendicular to the body axis. So that's the transverse colon, and then it starts going down, and that's the descending colon. All right, descending colon. As you can see, there's little rat pellets forming in there, so it's on the way out. So that's, at that point, it's going to connect to the anus, and then these rat pellets can be excreted that way. All right, the function of the large intestine is primarily to remove water, whereas in the small intestine, it's mostly to finish digesting food and absorb food. So the small intestine usually uses quite a bit of water to affect digestion and absorption of food. So the function of the large intestine is then to remove all that. Okay, so that concludes the view of the frog's anatomy. I'm sorry, the rat's anatomy.